Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Is your vision blurry? Are you tired of wearing glasses or contact lenses? You might be a candidate for LASIK eye surgery. What is it? How does it work? Joining us to talk about this is Dr. Peter Krall. He's an ophthalmologist with the Scripps Clinic Medical Group. Doctor, thanks so much for being with us.
Thank you for having me.
So LASIK it's a type of refractive surgery. What is that?
Yeah, so refractive surgery is the term that we use to reshape the front part of the eye in order to help people see without their glasses or contacts.
And so how does LASIK surgery work?
So basically, what we end up doing is, you see my eye model here, we have the cornea, which is kind of the front window to the eye. So the cornea helps, bend light into the back of our eyes so we can see clearly. So for people that are, say, nearsighted, we have to kind of reshape the front part of the eye. We kind of flatten the front cornea using our sophisticated laser technology. And as we do that, people can then see clearly without the need for glasses.
And is this painful?
It's generally not painful at all. We have excellent ways of anesthetizing or numbing the cornea. So, discomfort is not very common. There maybe is just a slight pressure feeling that people feel for a certain part of the procedure, but generally not painful.
But so the patient is awake during the procedure, or are they sedated?
The patient is awake, so it's not like general anesthesia. It's not like we're putting people under, but people are very relaxed. We give people an oral relaxing medication, and we make sure that they're very as relaxed as possible. And the procedure itself is very quick. I mean, it takes maybe 20 minutes to do both eyes for LASIK surgery.
And who's a candidate for LASIK surgery?
The best candidates are patients generally in their 20s and 30s. And so these are patients with a stable prescription, patients without a history of severe dry eye or without a history of any major rheumatologic diseases, and patients that are just looking to get out of their glasses and contacts. What we found over the years is just coming in, getting screened. We have excellent screening tools nowadays to make sure that you're a really good candidate before we actually offer you the procedure, and consultations are free.
This is not something, though, that you perform on children, correct?
It's not typically done on children, no. I think my cutoff is 18 years old. And even then, what you want is, in order to get kind of the most out of your LASIK and to not have to redo it, you really want a stable glasses prescription. So we're typically looking for at least 2 years or more of stability in your glasses prescription. And so anyone below 18, it's hard to predict that.
And what's the downtime?
Generally speaking, with LASIK, we can get people back to work or back to doing their normal activities generally after 24 to 48 hours. The first day, there might be some discomfort, some watering, a little bit of foreign, feels like something's in the eye for a few hours. But after that, the visual recovery is quite quick.
So how quickly are you back to living your normal life?
Typically have patients use eye drops for about a week. And so back to normal life, we'll say 4 or 5 days, pretty much normal life.
And so how do you know if you're a candidate for the LASIK surgery? What tests do you need to go through?
So when you come in for a consultation, we'll do a screening, what we call topography, or looking at the curvature of the eye. And that gives us a lot of information on whether LASIK would be a safe thing to do for you. So it has to do with the curvature of the eye, and also has to do with the thickness of the cornea. So with LASIK, we're removing tissue from the front part of the eye in order to reshape it so you can see clearly. But there's only so much tissue that we can remove safely. So we have to make sure that, with how much treatment you're doing, we have enough cornea to do that in a safe way.
Even after you've had the LASIK surgery, you might still need glasses for certain activities such as reading or driving at night. Why is that?
Yeah, that's true. I mean, with our technology, we are incredibly accurate with how well we can predict the refractive outcome, or how well we can make your vision after surgery. But there's no complete guarantees you'll be completely glasses free. I mean, there are certain things like night driving, you might feel comfortable with a slight glasses prescription, or possibly reading. It kind of depends on the patient, but the goal is to try to make you as free of glasses as we possibly can, and we're generally able to do that.
What happens on the day of surgery?
So the day of surgery, you'll come into the surgery center. and our technician will kind of have you come in and prepare the eye for the procedure, put in lots of numbing eye drops to make sure that you're as comfortable as possible. I'll come say hi, I'll double check everything, make sure the prescription is correct, and make sure we're ready to go. And then once we get you back to the laser room, there's really two lasers that perform this surgery. The first laser kind of cuts a flap in the cornea, and then we do that in both eyes. Once that's done, that's usually kind of the worst part of the procedure for the patient. There's a little pressure during that part. Then we bring you over to the second laser. We lift the flap, do the treatment, put the flap back down, and then do kind of a final check and make sure everything looks perfect before you leave. And the whole thing, like I said, takes about maybe 20, 30 minutes.
And then what should you be doing after the surgery? Are there any side effects? Should you be staying, let's say, away from sunlight? Should you be in a darker room?
So generally, people are a little light sensitive after the procedure. So I give people, I usually give people some relaxing medicine, and then maybe even a mild sleeping agent in order to take a nice long nap after the procedure. That's usually best. Your eyes are kind of, they feel heavy, they feel tired, maybe like a slight foreign body sensation. So it's best just go home, take a nice long nap, and then by the time you wake up, you're usually feeling a lot better. You can start your eye drops. And then I check in with people the next day just to make sure they're doing okay.
Are there any risks to LASIK surgery?
There are some risks, and generally speaking, those risks are very minor. There's a certain percentage of people that will get some dry eye symptoms after LASIK. That's fairly common, although that typically gets better. It's a very small percentage where that persists after they're healed. We're talking like weeks or months later. Same thing with glare and halos. Most people see some glare or halos around lights at night immediately after LASIK, but that does improve as time goes on. Some of the more rare things like infection or a bad inflammatory reaction, fortunately, these are very, very uncommon. And part of the screening process is to try to make sure that we identify any risks for those more serious complications. There is also the kind of risk, if you want to call it that, of being undercorrected or overcorrected. Like I said, we're very accurate in general, but you might be a little under, a little overcorrected. In that case, most of the time we can go back and do a touch-up if we need to, but that's pretty rare.
Any final thoughts, doctor?
No, I just appreciate the opportunity to talk about this, and I hope you consider LASIK if you're tired of your glasses and contacts, and come on in and we'll let you know if you're a candidate.
Doctor, thanks so much for being with us. We appreciate you taking the time.
Thank you.
If you want more information about LASIK eye surgery, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.